Hey guys, welcome to another episode of the High Ticket Coaching and Consultant Strategy and Growth Show. Now, if you're watching this interview anywhere else but within our private community called High Ticket Client Attraction Insider Circle, then definitely come check us out. We'd definitely love to have you. That community was put together specifically for coaches, consultants, and service providers who are serious about getting up to that sixth and that seven-figure level. So if that's you, definitely come check us out. So today I want to introduce you to one of the members of our community, Tomiko Joy. Welcome, Tomiko.
Hi, how are you?
I'm doing awesome. How are you doing?
I'm doing great.
Okay, perfect. So tell us, what is it that you do?
I am a physical therapist. I've been a physical therapist for about 23 years. And as I was talking to you earlier, I am working on branching out into the coaching industry. I know there are a lot of coaches out there. And so I kind of just want to bring to light the uniqueness of the type of coaching that I do. Related to people who have any issues regarding your physical health. The name of the work that I do is mind body coaching. So I really want to tap into people who are interested in getting in touch with creating a stronger connection between the brain and the body, and then bringing more consciousness to that awareness so that they can overcome their physical ailments and ultimately their physical pain. So a lot of the people that I work with are coming to me because they have some kind of pain or trauma. And so maybe if the root of their problem is trauma of whatever kind, because there can be all kinds of trauma, but I think that a lot of the people that I'm seeing on a clinical level are people whose trauma has related into some kind of physical symptom.
Awesome. So what got you started on this path to where, because as you said, you started off as a physical therapist, right? And
Yes.
now you're getting into coaching. What made you, are you changed over fully, completely? Are you wanting to do, why are you getting into coaching full time and getting away from the physical therapy?
No, I definitely don't want to get away from physical therapy because that is how I have learned to incorporate all the knowledge that I have into physical movement that actually can be used as medicine for the person. So I don't want to get rid of physical therapy. In fact, I want physical therapy and a clinical setting to be ongoing, a part of the work that I do. The people that I see in the clinic are often very different than the people that I see outside of the clinic. So I want to keep in touch with both sides, but I think my point of bringing up just my clinical experience really has to do with I want people to know that I am still immersed in a system that even though it's broken on so many levels, that I can relate to their personal experiences regarding their frustrations with healthcare. So if I keep one foot in the door in the healthcare system, that means I'm directly staying in tune with, what maybe the majority of people, at least in this country, I don't know how it might be for other people who live in other countries, but in our country, in the United States of America, I want to be able to, just bring the most cutting edge technology related to physical therapy when I am working with my coaching patients. Because I have experience being self-employed for many years and not really having any connection with people in the medical field. And, it was kind of isolating. And I don't feel like I lessened my skill level to any degree, but I will say that I did begin to feel like I was out of the loop. Like I was out of the loop of what was going on in the medical system. So I felt like, stepping back into it was one way to get reconnected with, the common experiences that people are having, as well as the type of patients that I see. So when I'm in the clinic, I am seeing very complicated, chronic conditions related. Most of my caseload currently is 90% is working with people that have pelvic health issues. So I don't know if you know anything about pelvic health. So 90% of the patients that I see in the clinic right now are pelvic health, and maybe like 10% of them are chronic pain cases who maybe have had physical therapy in the past. Some of them have not had physical therapy in the past. I think most of them have had physical therapy in the past, but they have never really learned how to manage their condition. And so I'm seeing them, you know, after they've gone through the rigmarole of all types of different healthcares, going to different specialists, going to different physical therapists, going to, you know, utilizing all aspects of healthcare, including counseling, chiropractic care, massage therapy, you know, people who are faithful yoga students. So anybody who's interested in health and fitness, and then all the chronic cases in between. So, you know, I might make it sound like the people that I see in the clinic are the worst off, but, you know, many of them are actually athletes. Many of them are athletes in chronic pain who have gone through all of these different kinds of treatments, and they still have not gotten better. And many of them, when they come and see me, because they're so motivated and they know their bodies so well, within the first, you know, within the first or second visit after the initial appointment, they are already talking about having remarkable changes in how they feel. And so I want to get deep into the core of that, because number one, healthcare dollars are hugely being spent on people getting ineffective healthcare. And so all this money is being put out to providers, and then patients are still not getting results. They're still feeling their symptoms. They're still in pain. And some of them, you know, I'm going to say most of the people that come to me, miraculously, they have kicked the opioid addictions that they maybe developed in their previous part of life. But there are still some that come in and they can't live without opioid medications.
Mm-hmm. Okay. And you said, of course, something you said 90%, did I get it right? 90% of individuals who do come to you, you said they have, what was it, pelvic issues?
Pelvic health issues? Yeah, pelvic health issues.
Mm-hmm.
So even though that is not the predominant experience that I've had as a clinician, as a physical therapist, but my current clinical setting where I've built a practice, 90% of my patients are pelvic health patients.
Mm-hmm.
But I see everything in between. So I've worked with sports patients and pediatrics and geriatrics and all kinds of patients, but my current practice right now are really some of the most complicated cases, which are the pelvic health patients.
Mm-hmm. Awesome. Now, when you're with I take it this is a physical business, right? So individuals actually have to come in person.
Right. It is a physical
treatment.
business. It's a physical business, but it's certainly a business that can be addressed outside of the clinic as well.
Mm-hmm.
So for people who live locally, you know, I do encourage them to come see me in the clinic, although I don't really have very much availability because my schedule is very booked. So one of my, you know, major goals for going out and doing some coaching is really to get away from the healthcare insurance industry. Although I can bill insurance even for coaching, even if it's out of network, because I'm a licensed physical therapist.
Mm-hmm.
However, I do want to get in touch with maybe a different kind of patient too, or a different kind of client, I should say, that is really willing to go the extra mile. Like maybe they have already done all of this stuff in healthcare already and they haven't gotten results. And so now I'm, you know, I know that the work that I do in the clinic, even though it's not completely transferable to a coaching business, it's certainly something that can get people on track, and I can direct and navigate that person within their own community on how to contact the right people to get the healthcare that they need. So, you know, I can be an advocate and I can be a coach and basically tell you what it is with physical movement that you need to do in order to get out of pain. At the same time, I can tell you what other kind of providers are going to be integral in your full outcome of getting rid of your physical pain. And
Mm-hmm.
that means that it could be, you know, referring you or recommending people in your own community, including doctors, specialists, medical specialists, which means, you know, anything from neurosurgeons to neurologists to naturopaths, acupuncturists. I have plenty of experience in coordinating and advocating for patients' healthcare so that they can figure out how to navigate through the system. So I can give the direct information to the individual about the physical part, but then when they have parts that I can't complete for them because they need to go get additional resources, I'm able to navigate them in the direction that they need to go in order to find the team that they ultimately need in order to overcome their issue.
Awesome. Love it. Love it. Exciting stuff. And with the coaching side, are you is it online as well? Have you
It
shifted
is. It's
online?
online. My main platform is Facebook.
Mm-hmm.
But I also do Instagram. I have to admit that I have gotten away from LinkedIn, and I know that you're on LinkedIn and you have invited me to join LinkedIn. I haven't had the opportunity to connect with that portal again. I used to have an account, but I've since gone away from that for various different reasons. It wasn't a platform that was working for me.
Mm-hmm.
So I'm also on YouTube. So I'm starting to ramp up on YouTube and get more information out there for people that they can use. But also, I really want to make sure that, you know, if I can't help that person directly, which I know that I can help to a huge degree, but I also don't want to eliminate other providers that might be necessary. Like, you know, maybe even if it's somebody who's interested in building a business. So you're a coach
Mm-hmm.
and you are building this multi-million-dollar business, and you're doing it successfully. And I can see how you do it, partly because you're approachable. And so that makes it, you know, inviting for people to do some work with you. And so I also want to make it, you know, just kind of somewhat turnkey for people so that they know exactly what the next steps that they need to do for their health, including if that's, you know, even making a choice regarding a business decision. So even if that's meaning like, hey, you guys need to go see this business coach because he is helping lots of people get their word out there. And if you need to get your word out there and it's not somehow it hasn't been coming for you to be able to get your word out there, then this is a person that you maybe need to speak to. One of the things that attracted me to your business in particular is these interviews. I find it very inspirational to listen to all different kinds of interviews from all different kinds of interviewers. I think it's one of the things that's been sparking my interest the most about being online is when I hear these people having these conversations and getting involved in a, you know, just a really unique level, because when you're doing an interview, you know, it's totally improvisational. So that means that whatever it is that you're putting out there live on, you know, in media, social media or other, that you're speaking from your heart and you are telling others what is the truest for you at that moment. And when it's live, you can't take it back. When you put it out there, it's just there. It's
Yeah.
there forever.
Mm-hmm. Exactly, exactly. That's so powerful as well. So, and as you said, really, it's just a conversation, right? Getting two individuals together and just seeing where each person's at, and basically brains. I guess my perspective one is more based on. I like to think about like if you go to a networking event or something, or you just meet someone and you just like, hey, let's network in public, right? So I see the interviews and I
Mm-hmm.
love it too.
Yeah.
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 So are you considering starting your own show? Is that what's going on?
What's that again?
Are you considering starting your own show?
To start my own channel.
Mm.
Like channel, what kind of channel? What do you mean when you say channel? What do you mean when you say that?
Interview. Where you interview others.
Yes, actually, yes, that is the other reason, and that I am interested in interviewing other people. I am so inspired. That is what keeps me going every single day. I mean, that's what I'm basically doing all day long. When people coming in for their appointments, I'm interviewing them. I'm interviewing them every day, and I'm interviewing them multiple times, and I'm interviewing them to see where they're at in every single moment and how we can change and shift the direction in order for them to get relief. And so the stories of the people that I work with are so inspiring to me. I would not be able to continue doing my work without these amazing stories.
Mm-hmm. Love it,
The
love it.
stories are amazing.
Yeah, yeah.
So yes, I'm actually very interested in I guess you said, starting my own channel. I didn't, think about it like that. I mean, I have a YouTube channel and I'm getting it started. So maybe I should consider that, one of my big platforms for a channel is like being on YouTube.
Mm-hmm.
So yeah, the stories are what I want to get out. The people that I want to promote, it's really important to me.
Yeah, love it, love it. Okay, so in essence, so what would you say? What's one skill you'd say you've mastered as you've been doing what you do has gotten you to your level of success today?
Listening is the biggest skill that I have mastered, and people do tell me again and again that that's what sets me apart from the rest is many people are telling me about how no one is listening to them, and they're telling all these different providers about what their needs are. And in fact, yesterday someone mentioned to me about how they were told that the problem they came in to see the doctor for, they were told that your problem doesn't have there's no solutions in modern medicine for the problems that you have. Okay, well, that's, the patient's story
Mm-hmm.
of how it went. And maybe that's not exactly what the doctor said, but it doesn't matter because that is how the patient left feeling, right?
Mm-hmm.
They left that appointment feeling like there's no hope for me. That's what I was told. But the person is super optimistic and they did not take that answer for the golden word. And so they went out and found the answers on their own. They even went to another provider. And when they went to that other provider, they were told at the front desk that there were no services available for the problem that they needed help with.
Mm-hmm.
So that is, one of the reasons why I need a different platform to just spread the word that there is help out there. And I think one of the things that maybe I'm frustrated about is that I know that there's plenty of coaches and lots of people in, health and fitness and even medicine that are experts in things that I possibly cannot do. But I want to get in touch with those who do it really well, because that is what's hard to find. Is it's hard to find other people that can do that work. And then it's also, challenging for the people that I work with to, if they, let's say they live where you live, they live in Indiana and I'm in Vancouver, Washington. And how am I going to help that person find the right resources if I can't maybe get my hands on them? And the reason why I say that is because I do a lot of manual therapy. And so I do spend a lot of time, with my hands on people. And so when I, can't find the right people, but, I am involved with a network of clinicians that are located internationally.
Mm-hmm.
And those professionals are called mechanical diagnosis therapists. And that's one of the techniques that I use. So I know that if I can find somebody that does mechanical diagnosis and therapy in the location where my clients live, then I know that they're going to at least be able to get some expert knowledge on some really key things that they need in movement or maybe if it's hands-on. I can do all the movement stuff online, but the
Mm-hmm.
hands-on stuff, I can't.
Yeah.
So I need to find, I need to identify the people who can do the hands-on work for those people in those situations.
Mm-hmm.
And that might be somebody that's certified in mechanical diagnosis and therapy.
Yeah.
And those are clinicians that I can work with. So that means that even if I'm here remotely in Vancouver, Washington, then I can call up somebody who's a mechanical diagnosis and therapist, and I can say, hey, I have this client that I coach and they need some hands-on therapy. They're not going to get their symptoms completely resolved without that hands-on therapy. So I do want to support those people that live in other locations that are far away from where I'm at.
Yeah, love it, love it. So we're kind of running short on time here, but if someone wanted to reach out to you, what's the best way for them to connect?
The best way to connect, I would say on Facebook, my business page, it's Tomiko Joy. That's Tomiko, and then the second word is joy, Tomiko Joy. That's my business coaching page. Then I'm also on Instagram, Tomiko Joy Saldia. You can also email me. So if you go on any of those portals, Facebook, Instagram, you can find information on how to contact me by email. You can contact me. I mean, that's either email. My phone number is probably posted somewhere, but I would rather not get too many phone calls. I would rather people contact me online. So email, or if somebody wants to text me on my business number, which is there, that's the only number that I have listed is my business number. So if somebody wants to text me, that would be great. But I will admit that if you give me a voicemail, the likelihood that I'll get back to you is it's going to be a while before I get back to you. I don't check my voicemails very often.
Awesome. Love it. Love it. Well, Tomiko, hey, thank you so much for stopping by today. Really appreciate it, guys. And if you're watching this on the live or on the replay, all the links Tomiko just mentioned here, they will either be above or below this video. So you could click right on them and just get connected right to her. So again, hey, thank you so much for being here. Do you have any final thoughts before we end?
No, that's it. It's so nice working with you today.
Awesome. Love it. Love it. Well, hey, enjoy. We'll talk soon.